Welcome to Global Health Action's COVID-19 webinar series. My name is Jenelle Williams and I serve as Director of Programs at GHA, and I will be your moderator. Today, our topic is risk communication and community engagement. And our first guest is Rania Elessawi, Communications for Development Specialist at UNICEF. She'll be discussing the recently released Minimum Standards for Community Engagement, which is a guidance document facilitated by UNICEF in collaboration with partners all over the world, including GHA. We are thrilled to have you here, Rania. Please go right on ahead and welcome.
Thank you, Jenelle. Sorry, I was just figuring out how to unmute myself. It's a pleasure to be with everybody here on this call, and I'm actually looking for familiar names, so I'm pretty sure that I will find some. But it is a pleasure to be amongst all of you today to present the Community Engagement Minimum Standards and Indicators that UNICEF has been working on, but with many, many partners, including Global Health Action Network. So it's a pleasure to be presenting to all of you and to share what the progress has been, where we've reached so far, and where we hope to go with this. And looking forward to the exchange with all of you on what is happening in countries on the ground and how could we leverage. So having said that, I'm going to jump right into it for the interest of time and to allow time for questions as well. So I'll be presenting these community engagement minimum quality standards and indicators that have actually been developed over a process of years. The actual process of developing this framework and actual document has started at the end of 2017, I would like to say. And this was inspired from a series of global events, mainly around epidemics and outbreaks, particularly the Ebola response in the first West African crisis in 2014-2015. So on that note, I will ask to go to the next slide and jump right into how the standards have actually been framed, what are the global principles and the framework that actually frames how we went about the community engagement standards. So next slide, please. Okay, so as I mentioned, community engagement is not new to any of us, particularly on this call. And I always say that when we do discuss among like-minded professionals, we are preaching to the choir. So the idea around the community engagement standards, though, was to elevate the focus and the accountability of these community engagement standards, and really highlighting that community engagement needs to be a very intentional and structured process, as well as highlighting that there are outcomes that are intended from community engagement. So based on that, it's embedded around these following global principles that highlight that community engagement should be a process and an outcome. And that is really highlighting the quality of community engagement that we intend, and realizing that there are multiple levels that we need to engage with, be them government or civil society or down to the community level, which is actually what we want to be focusing on. And it also raises the profile around accountability. What is the value add for community engagement? And what is the accountability of the multiple and the diversity of stakeholders that are mobilized around community engagement interventions? And then harmonizing our approach around community engagement is the other global principle that we speak about a lot, because there's so many organizations and contexts. In this current crisis of COVID, where we are all affected, how we engage, for example, in Western contexts versus how do we engage in the typical context that we have worked in as development organizations in Africa, as in South Asia and in the Middle East. What are the similarities and also what are the differences, and being able to account for that, but realizing that at the end of the day, there are core principles for us that we are committed to in terms of community engagement. And then how do we optimize what we do? And basically that is, more isn't always better. It's not that we need to be all the stakeholders involved, all the partners and organizations involved flooding communities and coming in with interventions, because at the end of the day, an intervention is an intervention. So how do we understand community resilience and engage around the parameters of communities? Because that is what true community engagement is about. Next slide, please. So this is just a quick overview. I'm not going to read through every slide, and this will of course be shared with everybody, but to say that in the development of the document, we looked at how do we align with the core standard frameworks that are already existing and align it with human rights principles that are already existing globally. So in the review and the development process, these were just some of the ethical foundations that we aligned the community engagement standards with. And I'm pretty sure that most everyone is aware of, so I'm not going to read through it. Next slide, please. So the actual process for the development, and as I mentioned, the actual formal process started at the end of 2018, and this was actually stimulated through the support of the Bill and Melinda Gates Foundation, where we do have a partnership, and community engagement and the development around core principles and developing a global good on community engagement was at the heart of this partnership. So really with their support, we were able to advance this work and mobilize and leverage the multiple partners that work in the space at the international level, including also working with countries, because the positive thing about our different development organizations, as well as INGOs, etc., is that we do, our work is underpinned in what we do in country offices, in countries and on the ground. So how we leveraged all of our expertise and linking with countries that we were actually working in during the consultation. So there were two levels. There was the level of looking at the literature that was out there and the documentation from different partners, the processes, the manuals, all of the literature around it, to have the evidence base there, and then looking at the actual consultations with stakeholders. So we did do some consultations with at country level to kind of validate our approach and the principles that we were looking at, and also to look at what were the practical mechanisms around community engagement from different perspectives, from a government perspective, such as local governments, as well as from different community systems, as Jenelle was mentioning. How do we leverage faith-based platforms? How do we leverage networks of community leaders? How do we leverage the informal and the formal networks? So these country engagements also were able to shed light on looking at the different roles and helped us to structure how the community engagement standards were finally developed. Next slide, please. So, and this is the uniqueness of the framework. The framework was actually finally agreed to have four specific parts. The core of it is part A, which looks at what are the core community engagement standards. What do we say are our core commitments and what we want to do? And then parts B and C and D are unique in talking about the implementation modalities. And that's the part that is unique, where we look at what are the different accountability structures? What do we need to ensure happens? How do we identify those that are involved? What are the human resources requirements that are required to actually be effective in delivering community engagement? And then the last section is on the actual indicators. And as I mentioned through the consultations, particularly the ones that happened at country offices, they shed light on being able to identify the critical stakeholders that need to ensure and facilitate both processes as well as outcomes that we intend from community engagement. And so the main stakeholders here that are relevant that the community engagement standards actually address are national and local governments. And then the other side is civil society, mainly NGOs, civil society, and implementing agencies. And one of the things that we wanted to try to do is, out of this process, try to begin to develop certain tools. And some specific tools that were prioritized through our consultation process was to develop a project cycle checklist. And that mainly addresses that when a program or a project is being developed at a community level, it can actually be adapted for even community level development of community engagement interventions. And this project cycle checklist is centered around the standards and the application of the standards, providing simple questions that would enable ensuring that we are covering what are the actions that we want to build into that program and making sure that we are aligning across the standards. The other checklist that is also unique is the funding institutions checklist. So from the programming perspective and as organizations that work in community engagement, what are the considerations that we need to think of when we are thinking of funding community engagement interventions? And I'm pretty sure that all of us very much know that in our field, oftentimes community engagement interventions are considered from a volunteerism perspective, that this is just something that needs to happen. This is something that people have to do, but resources and commitments of time of people is costly. So why we need to be intentional about community engagement, and we need to think about the capacity that is required, and all of these things require resources. So these are the considerations in looking at these practical tools for the checklist to say, how can we capture what are some of these actions, and how can we guide our own organizations in doing better in terms of our commitments? Next slide, please. So this is just a summary of what are the core community engagement standards. And in the actual document, for each of these standards, every one of these 16, the way that the document addresses it is that there is a definition provided for that. And of course, during the consensus building process, we looked at, again, at multiple documents and how we frame it to make it as inclusive as possible. So we provide a definition for every single one of the standards, and then what are some of the key actions? And then in the indicators section, we provide indicators that frame how would we monitor the implementation of these standards at different levels, and the levels of government and the level of implementing institutions. So I want to now move to what is the value add here, and fast forward to our current day that everybody is experiencing at the moment. So next slide, please. What is the application now in the context of COVID-19? So this is to say, of course, I did not give a full introduction about UNICEF, but I'm pretty sure that most everybody is quite aware of the work that we do. And UNICEF has been on the ground for more than 70 years. And actually the work that we started to do was in humanitarian and emergency response. So over the years, and I'm specifically going to talk about the most recent years, and particularly in regards to outbreak response, UNICEF has been engaged at country levels where you would see much more emphasis now on social mobilization and community engagement. And over the years, this has evolved into an approach called risk communication and community engagement to cover the spectrum of what we do, from providing information and around messaging to actually meaningful participation, including the most marginalized populations, and being able to engage with communities on a meaningful level. So what UNICEF actually does in countries that we are in is we coordinate through a co-leading process right now that is shared with WHO and IFRC. As co-leads in this sector, where we partner with government and aim to also engage partners on the ground. And I think most of the colleagues that will be on the call that are aware of humanitarian action and outbreak response have heard of, during outbreak response, these cluster mechanisms that are actually set up. So the risk communication community engagement pillar has evolved particularly over time from 2014 to 2015 to play a more central role that has leveraged further commitments also from donors to strengthen these mechanisms around risk communication, community engagement, realizing that social and behavior change is at the heart of everything that we do. And the first buffer to anything is for people to be empowered to take decisions for themselves. So next slide, please. And this is just to give a really quick overview of what we are doing on the ground. How is this linked and embedded in UNICEF's global strategy for what we do in countries? And this summarizes what our strategic objectives are and how we have taken the community engagement standards forward, because they basically inform everything that we do, from our framework and informing our coordinated approaches with partners, down to how we identify the critical behaviors that we want to address, and how do we work with communities to ensure that they are participating and owning the the actions that they need to do or take in during this response. And then being able to have clarity and a consensus around what are our approaches, what are our messages, and the materials that are required to communicate and engage with communities, to ensure that we have consensus across the board also in what we are communicating to communities as well. So there are, live links in this presentation that you can go into our website and be able to get more information about how we are taking our approach forward and how we are working with partners in countries. And then I think I have one last slide that summarizes what our core intervention components are around. And as I mentioned, it is mainly around the coordination and integration of community engagement and how we work with our national partners. Usually they are ministries of health or national disaster management agencies that are leading the preparedness and the response interventions in the country. And so we usually have those partnerships on the ground already through the systems work that UNICEF is engaged in, but we leverage it during emergency response and currently during the COVID crisis. And then the other area, of course, is focused on the behavior-focused participatory interventions. And the last is the capacity building work that we do with the multiple networks and platforms that we engage with that interface with communities. And just to say a last point, UNICEF is working across 7 regions across the globe. We're in 150 plus countries, and so we really hope that we can leverage you and you can leverage us, and particularly in COVID and beyond, in the system strengthening work to really amplify community engagement. Thank you. Last slide, and I could take questions.
Thank you so much, Rania. And I'm going to take this to the last slide. And then let's look at the chat room. I know we've got quite a few folks there. Thank you so much, Rania, for your presentation. I think there's so much there. There's so much meat that you've shared. And I think, as you shared earlier, one of the things that was pretty important for us as an organization to participate was to really have the opportunity to add some fodder, right? So add some of that conversation to what was being pulled together to synthesize, analyze, and then be able to kind of create what these minimum standards would be. As one of the things that we've been very aware of over the years has been the lack of support. And when I say support, financial support, planning support, to really support those infrastructures, right? Those community system infrastructures. And, you and I have had that conversation where it's been, hey, when you say community, what do you mean? Can we start there, right? Because community means something different depending on who you're speaking to. If you're a funder, community might mean something different than if you're a government, what community means for you. And so what we've found is that over the years of us working across those various sectors, there has been a lack of community capacity building. It's always been said, we use the terms, but again, if there are no metrics aligned to this, right, then there's no support really set up for that. So we'll have an emergency and everyone will rush in, address the emergency, wonderful. And then at the end of that, that's it, right? And then you still got folks working ad hoc based on what their needs are or their initiatives are, and not necessarily the level of collaboration that allows for sustainability and really preparedness. So I think my question to you is, and I've said a lot, I probably said, kind of like a dissertation, but I'll say this and sort of ask you this. What why now? Again, I'm kind of reiterating kind of some of what you shared, but why now? Why create this now? What for? And I think in the context of COVID-19, what's sort of your biggest takeaway or your giveaway for everyone that's on this webinar today?
Okay. Yeah, I saw a lot of questions in the chat box. So I do want to mention that what we can do is, because of the limited time, we could provide further responses to it, Jenelle, if you consolidate some of the questions. So yeah, so why now? I mean, I wouldn't say why now. I would say that we know this. This is nothing new to, I think, any of the partners here, as well as donors, as well as governments. I think what the community engagement development process in developing this actual document was to highlight actually the commitment from all of the different organizations that have engaged in it. And I have to say that you know, during the development process, we had partners that were engaged. And as the process started going on, we had much more interest from academia, from different types of donors, from even government partners to say, okay, so how, you know, like how do we frame this? You know, what is critical for us to do? So I think that this is what, as a document, it's a document, okay? And it could be a document amongst other multiple documents. What it's unique about, as you mentioned, is to say, we know that participation is important and empowerment is important, inclusion is important, but here are what we really mean by what are the actions that need to happen by government, by us as partners and civil society, and what can happen at a community level to ensure that that happens. And to say that these are intentional processes that require Part B and C and D of the standards, which are unique, to say, can we understand who leads in this space? Mm-hmm. Is it our local governance authorities? What is the role of the Ministry of Health or the subnational level authorities? What are their roles? What needs to change in our coordination? What needs to change in our integration? What needs to change in our human resources? Do we have human resources on the ground beyond just talking about community health worker from a system strengthening perspective? Do these community health workers have the support structures to help them to engage in a more effective manner, to validate and to support the trust that they already have with communities, and also to protect them, like in a crisis like COVID and Ebola, when you hear that community health workers, as well as community leaders and community representatives, get attacked because they are perceived to be an outsider at that point, because people have fear. So how do we look at these standards from an implementation perspective and recognize that this requires resources, it requires investments over time, it requires us to strengthen our relationship building and to strengthen the accountability between governments and communities. And all of these are intentional actions. This is not going to be implemented over time, and we have that realization. And we are just one partner and one actor in this broad spectrum of actors and stakeholders on the ground, but the real stakeholder is the community. So I think that this is really highlighting what our accountability is as organizations, because right now we are speaking as organizations, but we're citizens at the end of the day. And I think COVID has really brought that to light, to really understand what is our role within our own organization, but what is our role also as a receiver in these processes, and how do we reflect on that and take that forward. So that's what I would like to appeal to everybody, to think about it that way. I do not claim these standards at all to say that these are UNICEF standards. These are global interagency developed standards. How we take them forward is really up to us. And I think that that is what we should be focusing on going forward.
Thanks so much, Rania. I think we have maybe one or two questions here in the chat room that I think we can kind of touch on. One, in empowerment efforts to communities, how does UNICEF ensure child participation? We're talking about all this engagement, right? And what is the experience in the context of COVID-19?
that's a very long and big discussion, and I wish that we did have time for it, but I can definitely provide more information about it. Child participation, and particularly adolescents, as well as youth engagement, is critical to our agenda within UNICEF. We have actually similar webinar series that actually try to highlight and document what is happening on the ground, and we can definitely share these types of resources, because I think, you know, we for example, right now we have a global campaign that is being developed that is specifically looking at engaging content for children, and looking at issues around schools reopening and supporting education programs in countries, but doing that through also being able to ensure that we capture voices of children and how they feel about what's happening to them. So there is a global campaign that's also happening around that, that is that the focus is children and their parents. So there's multiple initiatives, and as I mentioned, you know, we can share the multiple resources, but that is one of the things that UNICEF does drive, the focus on a people-centered agenda and really identifying who are those different people and that their needs are all different. So I would really encourage you to visit. We do have a special website for COVID-19 and UNICEF's response, and I did put the link in the presentation. So please do visit it, reach out. And yeah, that's it.
Awesome. Thank you so much. And I think we've got one more. Someone asked a question, can you elaborate on this subpoint under Standard 2? Recognize that in-kind requirements or indirect inputs can be a burden to community members. Understand that volunteerism does not equal empowerment, nor is it always an appropriate expectation for a demonstration of community ownership. And I think you addressed that, but I think if you can bring some clarity again and sort of reiterate that point.
So we're specifically talking about within the core minimum standards on standard number 2. Okay. Yes, so definitely. I mean, as I mentioned, for each of these standards, when we're looking at the approach that we took is that we provided a definition around what we mean by empowerment and ownership. And it is really focusing on, you know, what is the efficacy of every single individual actually to take their own decisions. And you know, we've had this long existential debate, I think, in our field, talking about empowerment from how we empower people, but this is really saying that there are no processes to empower people. Empowerment is more about the individual and their own efficacy to take information, to receive it, and then to take their own actions. And that's how we've approached the definition around empowerment and ownership. And so please, I do encourage everybody, now that the standards are out there, to take a look at it and look at how we apply it. And also looking at the project cycle checklist, I think that they're quite useful because they frame that. And we're more than willing to have further discussions around implementation tools and frameworks with different organizations. So, yeah.
Awesome. Thank you so much. And I think, Rania, you know, one of the things that we've recognized is, you know, we all have circles of influence. And you've alluded to that in the sense that, you know, there is an infodemic, and we're waiting to hear from a risk communication expert at WHO. But one of the things that we are in very, we've recognized, at least in the last couple of weeks, is the number of webinars and the number of materials and the number of Facebook and WhatsApp and all of these different sort of communication tools and platforms. And everybody is saying something, and everybody's creating something, and everybody's got their own sort of platform that they've created. And so what I'd love to do is really kind of talk a little bit about the power of sharing information from your circle of influence. And so we as GHA, we're not the largest NGO. That's not our space. It's never what we anticipate being. We're definitely that in-between connector. And so we recognize we have reached to some people that no one else really will be able to connect with. And so how do we begin to think about, and again, this is community engagement on a different level, how do we think about connecting those dots, right? So there's one of connecting to UNICEF, there's another connecting to someone else, and how do we begin to sort of share, right? Share the love. How do we connect those intersections? if I'm making myself clear. I think that's
Yeah, absolutely.
needs. And I realize we all want to be stars and we all want to have credit. And that's been a big challenge, I think, both at the local level all the way up to the top, especially in COVID-19. And so I know that's a statement and the question, but I kind of pose it to you as we're having this discussion at this moment.
Yeah. So from a very practical perspective, Jenelle, I'll say two things. When I mentioned what is happening around risk communication, community engagement, I'm sure Melinda will speak to this a bit more. In country offices, and that's really what we leverage, what is happening in countries right now is that there are partner platforms, and in different countries they're calling it different things. There might be a working group or a task force or a coordination mechanism, but there are partner platforms for risk communication, community engagement, and these platforms are to engage the multitude of partners, because you are absolutely right. We all bring different strengths. We all have different stakeholders that we work with, and communities that we work with, and networks that we leverage. One of the core things in the coordination is actually to conduct mappings early on. And there are country implementation plans that are developed in almost every country, whether they are, well advanced, or they're task oriented at the moment. I mean, it really depends on the capacity within country, but that is one of the things that we are focusing on. And through the co-leadership of WHO and IFRC and UNICEF around RCCE, this is the objective of having these platforms established and functional to the level of being able to understand the capacities of different organizations, so that we are not overlapping. I mean, I think one of the things that stands out in my mind always is during the Ebola response, 2014, 2015, infodemics and too much information is sometimes more detrimental to lack of information. Okay, because people look at their trusted networks. When in the heart of the crisis in Liberia, where I was, fear and mistrust is perpetuated when you don't work with the partners within communities, or the influencers within communities that people already trust. And so until we were able to coordinate ourselves much better, so that we didn't flood communities. You didn't find 10 different organizations or 20 different organizations in some instances. It was terrible, actually. You can't expect communities to engage with you, or to even provide you with entry or any level of trust, if you are not going through their modalities, right? So, I mean, I think that this is what the community engagement standards also very much highlights, that participation is the first standard. How you participate, who is the messenger, like you said, the trusted messengers, the trusted entries is really critical. So from a very practical perspective, I would encourage all the partners that are on the call, whether they're at a country or a regional level, to reach out to these partners and to get engaged in the partner platforms that are there, and bring to the table what they also, the communities that they work in, because we need to leverage each other.
Thank you so much. And it looks like we're having a challenge pulling in Melinda. I know that she's literally running from meeting to meeting, and hopefully she'll join on. We might need to pull her on at another time. So I think at this moment, what we can do, Rania, is we can continue the conversation, have a deeper dive. I do want to share with folks a few of the resources, because I will say that Melinda was planning to share quite a lot of detail regarding the risk communication side of the house. But can we talk a little bit, Rania, about the why is risk communication and community engagement in the same sort of topical area, right? And then I can sort of add a little bit more, but I think that's sort of a good sort of segue into this next phase.
I think, what we have to recognize is that there is a continuum, and I think that is really what we leverage. So when we think about messaging, particularly, and this is what I think most practitioners kind of think about, where we begin and where we end, and how we interface. where risk communication is very much more around, as you had mentioned, what are the messages, what are the trusted messages, what's the right information, right? And who is it that needs to communicate that? And then community engagement goes deeper, because that is within identifying the different actions and how people are having two-way feedback. It leverages people's own capacities to be able to respond to their own needs, but also engage who they need to answer some of what further information they require. So there's this constant interchange between risk communication and community engagement, where they inform each other. As rumors or issues arise, that informs what further needs to be communicated, and that informs what type of messaging needs to be further generated or created. But then who is communicating it, and then who's engaging within the community is what really makes a difference. It's what stimulates action at a community level. It's what motivates behavior change and social change down the line. But so that's the interface between both of them, and that's why they, risk communication and community engagement coming together actually support each other.
Fantastic. Thank you so much. And again, I guess, one of the things that would be also helpful for folks to understand or kind of learn a little bit about is the relationship between sort of UNICEF and WHO, and how this interface, how this collaboration occurred, because I think one of the realities that we're seeing sort of more and more is there's a lack of trust in many of the institutions that have had incredible trust at the governmental level, national level, also at the community level. And now we're in an environment where that trust has been eroded with, again, a lot of from sort of this infodemic and this idea, what is public health and why is public health critical and crucial, and who's listening and who's speaking, and that dynamic. And so I think one of those sort of critical root issues is, connecting people who are literally providing healthcare services, and or folks who are the grandparents or the preachers or the pastors or the imams. Who are the folks that actually have that level of credibility, how to connect those dots with them. So one, I'd love for you to share the relationship, and this is kind of why the UNICEF WHO meeting was going to happen today, but then also how can we also help to clarify for folks the relationship, and again, really this is part of also showing the implications and the impacts UNICEF and like multilateral organizations have had and continue to have. The fact that there are platforms, well then people need to figure out how to communicate or connect with them so that they know, if I know who I'm working with, there's a lot less chance of me not believing or not trusting what's occurring. And so thank you for being a face to the name UNICEF. Thank you for spending this time with us to share. But like I said, I'd love to kind of come back to you about that. Yes.
Yeah, absolutely. So would you like me to talk about the relationship? Okay. So, I mean, I think that everybody is kind of aware of World Health Organization, and probably during COVID even more. Right now I'm based in New York, but in other countries that I have been in, I think WHO always had a very respected role because it is the global organization or institution that represents anything and everything about health. Okay, that's just in simple layman's terms. And I think that even during COVID, this was very clear there. And I just want to maybe just highlight a couple of things. On the issue of trust, there is a lot more happening in this space. And of course, it is at the center of, preparedness interventions, as well as emergency response and outbreak response. And trust is a very long-term relationship that is built over time. And so when we're talking about it right now here, I think we won't do it justice to unpack the multiple levels around it. So as international organizations, whether it is WHO or UNICEF, I think that has a lot more to do with brand values, where people recognize them as organizations that have been in country for a while. But then there is our linkage with government, because as UN agencies, we do work very much closely with governments, as well as civil society in the broadest sense, of course. So where we are as decentralized organizations, and particularly UNICEF, as I mentioned, we have country offices in 150 plus countries. So people recognize UNICEF also within countries as a trusted agency or institution that focuses on women and children, right? So whether we're engaging with civil society or government, but our emphasis or our objective at the end of the day in our field of development, international development, is for us to work and invest in the capacities of our national partners down to the community level structures to one day not be there. Okay, because that is what our intention is. So I think from that perspective, if we're thinking about trust, yes, we can talk about brand value and how people consider these organizations at different levels in countries. But then from the perspective of global trust and what we're seeing happening during, and it's lending the emphasis on what we need to do better in the future on preparedness is there are lots of issues around ethics of communication and community engagement and competence of different organizations. There's a lot of data that's out there right now. I hope that people have heard of the Edelman Trust barometer that has been conducting studies around trust for years. They did a special COVID one that looked at governments, and if we want to think about WHO and UNICEF as working with government very closely, that's a very interesting perspective because it impacts how people will view us in countries as well. And it looks at civil society, and it looks at private sector and media, and how much people consider trust from an ethical and competence perspective. And I think that that's something to say because that's a commitment from these different, institutions, whether it's media or civil society, and where we consider ourselves. And over time, actually, during the crisis, government was actually faring pretty poorly at the beginning of the crisis. And the shift in trust towards governments has actually changed over the last 2 months, which is very interesting. So I think when we think about, organizations, whether we want to use, say, I'm WHO, or I'm Save the Children, or I'm UNICEF, I think what the critical thing is how do we work together to leverage how communities perceive us and how we are trusted within countries to do the work that we do and to do better in terms of what we do around community engagement and communications, because oftentimes that's the first line of defense. Okay, how people can prevent and protect themselves to begin with from getting a virus during a pandemic or an epidemic is the critical thing. And then the interface with services is a whole other issue. But what we actually want to focus on is what our roles are as WHO, UNICEF, IFRC, other organizations, everyone on this call on prevention and protection first. And that's why we do RCCE. So I hope that answered your question.
Thank you. Oh my goodness. So Rania, again, so I'm going to put this back on you again. This is great. So we had some questions that were getting a little bit into sort of the weeds, and it's not really the weeds, but this is sort of more pragmatic and practical. So they're like, okay, so here's the great implementation framework that's been shared. Thank you, UNICEF. Fabulous job. Thank you, all of the partners. Fabulous job. But, we've got COVID-19 today, and we have got to practice social distancing because there is no vaccine, and we don't know how long that's going to take to occur. So what are some strategies that folks can employ to really do some effective community engagement? So I'll sort of start some of that off and let's kind of have this back and forth. But one of the ways that we've been seeing, it's been interesting. I said, I'm sick of Zoom. I feel like I'm zooming. I'm zooming for work, and now I'm zooming for life. If you have faith-based, that structure that you're a part of, or institution that you're part of, folks are zooming to church, folks are zooming at the mosque, folks are zooming everywhere. So I think Zoom has definitely benefited from this. But what I'll say is that there have been sort of nuanced and different ways that folks have been thinking about how to do these and have these conversations and engage with each other. So things as simple as picking up the phone and calling folks more often, doing more check-ins. We've had folks who are on the ground who are doing mental health check-ins. Just do a phone call. You can't socially distance and sort of be in someone's space less than 6 feet, less than 3 feet. So what do you do in those scenarios? And so we've had folks literally have meetings where they are practicing the social distance recommendations, and doing that in a way where they're recognizing, okay, well, we can't control everything, but these are the things that we can control. So that's for meetings. But again, I think what I've also recognized is people feeling like they have been able to get to know folks better, because they've been more intentional about their engagements. And so that's been an interesting dynamic as well. So I think there's definitely something to think about in terms of how we're using technology to further social engagement, and not just sort of community engagement, really social engagement. So I'll just kind of stop there for now, but go right ahead, Ron.
Yeah, so yes, I did see one of these questions as well. And what I would love to do actually as a follow-up, Jenelle, is to share additional resources with you, or a list of additional resources. There is an excellent resource that has been developed. It's a live document where we're trying to address exactly what you're talking about. And I mean, again, it's a collaborative effort of multiple organizations that are already working in countries to consolidate different examples of community engagement, considering physical distancing. And then the caveat, right, is there is different countries and different contexts. So you have countries that are in complete lockdown. You have countries that didn't have lockdown, okay? And there's other terminologies like confinement and deconfinement and isolation. And so what we try to do in this resource guide is to consolidate the multiple scenarios that community engagement happens in, and to give particular examples of what's happening in different countries. So I can definitely share that because it's a great resource, because it's developed through a partnership platform of multiple INGOs and NGOs globally, including CORE and Ready Group. So there's a lot of organizations that are quite involved, and we're continuously feeding into that and following it up. So I invite everybody that is here that when we do share that resource, if you are interested also to be able to provide feedback to that, it would be great. But it is definitely what you're talking about. It looks also at low resource settings. So when we're talking about informal settlements and urban areas that are quite populated, what can we do in those areas? Because density of population is a scenario that is going to happen. So what do we do in those scenarios? So we have tried to document these different types of settings and what we can do in these different types of settings, what different community mobilizers or faith leaders, what they would do. So within their functions within society, what would they be, how can they also engage, and how can they tailor that? So yes, you will see the spectrum of there is a discourse happening of the over-reliance on digital engagement, but realizing that penetration in rural communities and other communities is very poor. So what do you do in those settings? And having that understanding and being very honest about how do we ensure that we are reaching the most marginalized populations and those that are left out of that sphere of digital engagement. So I'll share with you that resource, and we can definitely follow up on that. And I'm pretty sure that there's tons of amazing examples and work from the network here, and we welcome integrating what great examples are out there.
I think that sounds phenomenal. Thanks, Rania. I think there was also another question that was asking about sort of training for community health volunteers or community health workers, and I know there's also a ton of resources that are popping up around that. I think WHO's actually created an app most recently for community health workers or community health volunteers, and we can also get that out to folks as well. I think there's a plethora of information. I think the challenge has been how to direct, kind of synthesize and direct the information to the folks and the people who actually need it and need to utilize it. Unfortunately for our call, we have not had Melinda, and been talking to Melinda all morning, so I know it's been a technical gaffe. But and of course, we've got the World Health Assembly meeting. We've got a CSE. There are lots of things going on right now, so we do recognize that. What we'll do after this meeting is, one, this meeting has been recorded. So the webinar has been recorded. That will be up on our website early next week. We will send a note to everyone that registered on the call for that. In addition to that, we're going to have the PowerPoints and the slides from the presenters. So you'll also see the risk communication slide. There will also be additional resources. Of course, the ones that Rania will share, and then sort of all of the other resources that we've begun to sort of amass and pull together, and also some of the other partners in groups that are working, on these issues. I will say that there is an incredible resource on the WHO site that we've been sort of transliterating and working with partners around that. And so really kind of providing that technical assistance for folks to kind of take these sorts of measures and indicators and these ideas and sort of bring it down practically on the ground and sort of have these conversations. And so we're definitely going to share out that resource and that connection. If folks are interested in learning more about global health action, learning more about UNICEF, learning more about the work within risk communication for WHO, we'll also be sending that information out. Certainly use our website. We've just retooled it, so we're still adding more info to that. But again, I think there's definitely an opportunity for us to strategically connect and strategically partner and begin to take the work of community engagement to a different level. I do see and foresee that in the coming months, in the coming years, we're going to see more and more of a need for us to have similar language. And I would say that that has been, I think, sort of the biggest bite or the biggest support or the biggest, I think, giveaway in developing the standards, is that's the word, the minimum standards. And that's why we called it the minimum standards. And the idea was that this would be sort of your base to start conversations across the world at any location around the world on these things. So with that said, I know that someone was asking some more questions about standards. What we're going to ask you to do is a couple of things. We have hashtags. If you look on our website, if you look on our Facebook and you look on our Twitter, go there. We'll continue the conversation. After this call, it's hashtag GHA COVID-19. There's hashtag GHA series. But there are several hashtags that you can kind of circle around and continue this conversation. As Rania shared, we're going to take basically the transcript from this, the transcript of the chat, and then post together some questions for her and colleagues. And then we will have that bounce back out to everyone that's participated. Again, we're at the top of the hour. I want to say thank you so much for Rania. You have done such an incredible job for participating with us and truly demonstrating community engagement, right? This is thinking on your feet and being responsive and being ready to meet whatever the need is, irregardless of the challenges that come. So again, we thank you. We look forward to more engagement. We're excited that we were a part of that process and look forward to continuing that relationship. Everyone who's been on this call, thank you, thank you, thank you. We look forward to more engagement. Please take a look and make sure that you show up for our next webinar next Friday, same time, same place, on GBV and gender equity. We have some great folks that will come on board. Have a great day, everyone, or a great evening. Thank you. Goodbye.
Thank you, everyone.